Nursing Aide Qualifying Exam Reviewer. Let's get started. Before touching a resident who is crying to offer comfort, the nurse aide should consider: is it A, the resident's recent vital signs? Or B, the resident's cultural background? Could it be C, whether the resident has been sad recently? Or lastly D, whether the resident has family that visits routinely? The correct answer is B. Here is why. Physical touch as comfort is perceived differently across cultures. Some may welcome a hand on the shoulder, while others may find it intrusive or disrespectful. Considering this shows cultural sensitivity and respect for personal boundaries. Vital signs, while part of overall assessment, are not the primary factor in deciding to offer comforting touch. Recent mood and family visitation patterns are background information, but the immediate decision should be guided by respect for the individual's cultural norms regarding touch. Next question. When a resident is expressing anger, the nurse aide should: is it A, correct the resident's misperceptions? Or B, ask the resident to speak in a kinder tone? Could it be C, listen closely to the resident's concerns? Or lastly D, remind the resident that everyone gets angry? The correct answer is C. Here is why. Active listening validates the resident's feelings, helps identify the source of the anger, and is the foundation of therapeutic communication. Correcting misperceptions during the anger can come across as argumentative and escalate the situation. Asking for a kinder tone dismisses their emotional state. Generalizing their anger minimizes their specific experience. Next question. When giving a back rub, the nurse aide should: is it A, apply lotion to the back directly from the bottle? Or B, keep the resident covered as much as possible? Could it be C, leave extra lotion on the skin when completing the procedure? Or lastly D, expect the resident to lie on his/her stomach? The correct answer is B. Here is why. Maintaining draping preserves the resident's dignity, modesty, and warmth during the procedure. Lotion should be warmed in the aide's hands first to prevent a shock of cold and for better control of application. Excess lotion should be gently rubbed in or wiped off to prevent skin irritation and soiling of gowns. While prone is common, residents may receive a back rub in a side-lying position if they cannot lie on their stomach. Next question. A nurse aide finds a resident looking in the refrigerator at the nurse's station at 5 a.m. The resident, who is confused, explains he needs breakfast before he leaves for work. The best response by the nurse aide is to: is it A, help the resident back to his room and into bed? Or B, ask the resident about his job and if he is hungry? Could it be C, tell him that residents are not allowed in the nurse's station? Or lastly D, remind him that he is retired from his job and in a nursing home? The correct answer is B. Here is why. This response uses validation therapy by entering the resident's reality, showing interest in his concerns, and addressing a potential need, hunger, while gently redirecting. Forcing him back to bed dismisses his current reality and may cause agitation. Simply stating a rule without addressing his perceived need is not therapeutic. Attempting to reorient him to a potentially painful reality, being in a nursing home, may increase confusion and distress. Next question. Which of the following is true about caring for a resident who wears a hearing aid? Is it A, apply hairspray after the hearing aid is in place? Or B, remove the hearing aid before showering? Could it be C, clean the ear mold and battery case with water daily, drying completely? Or lastly D, replace batteries weekly? The correct answer is B. Here is why. Hearing aids are electronic devices that must be protected from moisture to prevent damage. They should always be removed before bathing, showering, or swimming. Hairspray can clog the microphone and should be applied before inserting the hearing aid. Ear molds should be cleaned with a dry cloth or specific cleaner. Submerging in water can damage the device. Battery life varies, often 5 to 14 days, and weekly replacement is not a standard rule. They are changed when the device indicates low power. Next question. Residents with Parkinson's disease often require assistance with walking because they: Is it A, become confused and forget how to take steps without help? Or B, have poor attention skills and do not notice safety problems? Could it be C, have visual problems that require special glasses? Or lastly D, have a shuffling walk and tremors? The correct answer is D. Here is why. The cardinal motor symptoms of Parkinson's disease include bradykinesia, slowness, shuffling gait with small steps, postural instability, and resting tremors, all of which directly increase fall risk and necessitate walking assistance. Cognitive changes like confusion can occur, but are not the primary reason for walking difficulty. Attention deficits are not a defining feature. Visual problems are not a primary symptom of Parkinson's. The gait disturbance is due to neurological motor control issues. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.